A U.S. district judge in Montana has ruled that a person's personal vaccination choice does not outweigh public health and safety requirements in medical settings. The ruling permanently blocks a section of law in the state that was meant to prevent employers from discriminating against workers by requiring them to be vaccinated against communicable diseases, including COVID.
In his opinion, the judge wrote, quote, "The public interest in protecting the general populace against vaccine-preventable diseases in healthcare settings using safe, effective vaccines is not outweighed by the hardships experienced to accomplish that interest." So there was a law in the books in Montana that made it basically illegal for anyone to private employers to this was a private employer context, but employers to ask whether or not somebody was vaccinated in order to require them to be vaccinated. Generally speaking, the equal employment law says that, private employers have the right to require vaccination or other kinds of interventions. In this case, the state of Montana had what is being described as an anti-vax law that says you don't actually have that right. And this now overturns that and says that in the healthcare setting, there is this ratcheted up public interest in not having communicable diseases spread. So you can't make it illegal for them to be able to have you to require to.
But what I frankly don't quite understand is I think this might invalidate the entire law, not just the healthcare portion of it, which would not, to my view, would not be necessarily a bad thing. So I oppose vaccine mandates generally requiring vaccines. I don't think the government should require private entities to vaccinate their workforce. For the most part, I don't think they should require. Maybe they have the right to require public employees. I don't think they should, because it's not justifiable from a public health standpoint, because the vaccine is not holding back cases. It's really just a personal protective measure. That said, I would not support a law that prevented a private workplace from having a vaccine requirement. I may disagree with the private workplace's decision to do that, but it's their choice. It's a mandate in the other direction. And I think it's very unfortunate that everything in our society now, including a lot that has to do with COVID, everything has to be mandated or forbidden. Like that's not just let private people associate with who they want to and decide what the rules are within their own spaces and spaces that they control. Seems fine. I remember, Ron DeSantis prohibiting not having vaccine mandates is good, but then he prohibited cruise lines from requiring vaccination, which the cruises are the most disease-spreading kind of thing. Again, maybe it's not a good idea. Maybe I wouldn't agree with it, but I would not prohibit them from doing that. If this ship driving around Florida wants to say everybody who gets on my ship has to be vaccinated or show me they're vaccinated, and you're the government telling them they can't do that, that doesn't make any sense to me. Similarly, if I ran a nursing home, and I would want the people who worked in the nursing home to be vaccinated.
And maybe
especially at the time when it was holding back cases. Maybe it's not doing that anymore. Maybe it doesn't matter now. But I don't think it's out of the question to require that. But also maybe you
want your residents to be vaccinated.
Yes, I would absolutely want the residents to be vaccinated.
There are, really cynical, horrible financial reasons why you don't want all your patients to die. You maybe don't want to get sued for the consequences of letting mismanaging and letting the disease run rampant through your facilities. So there's a lot of, frankly, market capital type reasons why employers might want to be able to take these kind of protocols. I also think that this case happening in the context of hospital staff is relevant to what the outcome was, because apparently, a lot of people who work in the healthcare professions are frontline witnesses to what it means when ICU beds get filled and people who are disproportionately unvaccinated end up being in the situation where they're, taking up a lot of the care capacity of these institutions. And I think there probably is this cultural aspect of, I know better. I see the worst of COVID every day, and you're still going to put yourself as an employer in a position to occupy one of these beds and make life harder for everyone who's in this profession. So, I'm curious to know what the audience's take on this one is, because I do think that we had this conversation yesterday about freedom, positive freedoms and negative freedoms, having the freedom to do what you want and also having the freedom from being told to do what someone else wants you to do. And so much of, the COVID conversation is about the government forcing you to do X, Y, and Z. And sometimes these bills that are opposite aren't framed in those same ways because the politics flip. What side you're on flips.
This is an example of the government telling you that it telling you something with respect to a vaccine mandate, and the government should not be the decision maker there. In this case, it's saying the opposite of what some other governments say. Government's saying you have to get vaccinated. They're just sort of saying we're not going to let this privately controlled space set a vaccination rule. I don't think the government gets to do that. I don't think they should do that.
This is like maybe akin to criminalizing parents who choose to allow their kids to have some kind of gender-affirming care. You know, it's one thing to say...
Throw that at us late in the day?
No, I'm just saying, it's one thing to say, I don't want this put on my kid, whatever that means. Mm-hmm. It's another thing to say, we've made an informed choice, and this is something that we want, but the government is literally going to tell us that it's illegal for me to do this. I mean, is the government going to start stepping in and saying, you're not allowed to get your kid's ear pierced, or you're not allowed to get your kid a nose job, a boob job? Maybe I think that they should, but I think we can all acknowledge that's a kind of space that historically we haven't been comfortable with the government occupying.
However, it is true, right? There are examples of from workplace safety, workplace harassment. There are all sorts of ways in which the government does set some rules for the workplace. So I'm sure the defenders of this law would say, well, just like your employer can't ask sexuality or your or some other, maybe your immunocompromised status, something relating to your health. They probably can't ask you if you have HIV or something like that, or cancer. They can't ask you whether you're vaccinated. So I see from that would probably be the rationale for it. But
I wonder, though, and I don't know this, but I wonder if nurses, people who work in hospitals, are required to have certain vaccinations, for common diseases that come through.
I'm sure they are.
Just the way that military officers, people who travel, go to certain parts of the world, are required to get yellow fever vaccinations, hepatitis C, things that aren't on the normal schedule for the average citizen. Yeah. Well, let us know what you think, and we'll have more Rising for you right after this.